You're very welcome to this talk. It's Saturday the 27th of February. Now I want to do a quick review of what's going on in the US and the UK, but I want to focus today on some of the excellent quality, very rich vaccine data coming out of Israel. Now we expected the Israeli data to come first because they're ahead of their vaccine curve in terms of per capita vaccination, so we'll look at that. But I just want to start off with the United States, a bit of a correction from yesterday, really. So yesterday we were concerned about this slight upward trend in the United States. And we can see now it seems to have gone down a little bit. Now this is from Our World in Data, which is somewhat more up to date than the Centers for Disease Control site, actually. Canada we still see is sort of flattish. The United Kingdom we know is going down. But if we look at this in a little more detail, we see that we're worried about the United States, but now the data does seem to be heading down again. Now, there seems to be particular factors going on here, and Mike has written in to clarify this. So factors in increasing cases and deaths from the States. Now, there's a few factors here, and they do seem to be artifactual. So the weather has caused a lot of delays in data from the appalling wintry weather, especially surprisingly enough, in the southern parts of the United States. It's also been quite a lot of people on holiday or vacation over the last week. And Virginia and Texas had a backlog of deaths that were not reported that came all at once. So that did make the situation in the States look actually worse than it was. Now, I should have realised this at the time, but to be fair, we are expecting a pickup in data from the United States in the number of cases. Probably not in the number of deaths, as we did see yesterday. I believe that was mostly artifactual. The deaths are still high, but I don't think we will see a pickup in the number of deaths in the States, because although we will see more cases, I believe, as a result of the new variants, people who've been vaccinated are much less likely to get severe disease, much less likely to die. And as increasing proportions of the United States become vaccinated, the death rate will correspondingly go down. So I think that's quite an important clarification. It's often like this. It's confusing between what the data is actually saying and what the situation on the ground is. Let's have a quick look at the Centers for Disease Control site, actually. Yeah, we see that's a little bit behind, so that's still showing the slight increase there. But we now believe that to be artifactual due to those factors that we'd mentioned. And likewise, the deaths in the States, which are high, this probably is an artifactual blip up the way because of the weather, the delayed data from Virginia and Texas particularly, and the effect of the vacations or holidays that people have been having. It's always tempting to look at more when we're on the CDC site. It's so interesting. Here's one more. This is COVID symptom tracking data for hospitalization. So patients hospitalized with confirmed COVID-19. And it really is a gratifying downward trend that we're seeing. So 48,194 hospitalized patients. That's data from the 24th of February. Frustratingly, always 3 days out of date on the Centers for Disease Control, but it's unavoidable when they're collating data from all the states. Current 7-day average is 52,000. Prior 7-day average was 61,700. It's not long. It was well over double this just a few weeks ago, way over double that. So this is good. There's still pressure in many areas, as there is in the UK, but it's a 15.4% reduction in data from the United States. And as you see, there's actually been a little bit of sunshine in Carlisle today, so we've had to put a screen up. Now, just before I go on, Winston has just reminded me. Now, I have no commercial interest in Aldi, but this is the cheapest vitamin D I've ever found. So it's 3,000 units, 3,000 international units per tablet, which is 75 micrograms. And there's 90 tablets there, and that cost £3.49, which I guess is about $5. So no reason why it shouldn't be cheap. They can make this stuff for basically nothing. So 3,000 unit doses there, 90 tablets, £3.50 English. So I like a bargain, don't like paying over the odds, especially for pharmaceutical related products. It really profiteering in pharmaceutical products and medicines and healthcare delivery of any sort is my particular loathing. Right, so they were the factors from the United States. So thanks to Mike for that. That really is quite illuminating and makes sense now. And we looked at the trends and the hospitalizations there. Now moving on to vaccination news. Johnson & Johnson authorization. So the CDC said they liked it yesterday, as we expected. And I'm expecting the authorization today. I'm hoping it's today, Saturday, the 27th of February, for the Janssen Johnson & Johnson authorization. Now, I believe there's 4 million doses on the shelf of the Johnson & Johnson Janssen vaccine. Not a lot, to be quite honest. Manufacturing is behind where they want it to be. It is going to increase very rapidly soon. But Johnson & Johnson vaccines aren't going to flood into every vaccine centre in the States and solve the supply problem. Yes, there'll be a big part of supply answering that supply problem, but the supplies will increase gradually over the next month or two. So there's going to be a complete glut of vaccines by summer, but it's still a supply issue in the United States, as it is in Canada, as it is in the UK at the moment. Won't be for much longer. We are rapidly getting our acts together. California is expecting, for example, 380,000 doses by next week. Not a massive amount when you think of the size of the state. Big advantages here. This is a single shot, one vaccination, one injection. This is the first single shot vaccine to be approved, when it is approved later today, he said, sticking his neck out a bit. If not, it's going to be really soon. I think it will be today. Normal fridge temperatures for 3 months. It's a viral vector vaccine, the same as the Oxford AstraZeneca vaccine. And I can't remember the price of the Johnson & Johnson, but I'm sure it's cheaper than the Pfizer. And I'm also sure the Pfizer is cheaper than the Moderna. So I think it's around about $10. So it's not as cheap as the Oxford AstraZeneca, which is about $3 per shot. But of course, it's only one shot. So if it is, from memory, $10 a shot, then that is $10 per vaccinated, immunised or largely immunised individual. This is value for money on a fantastic scale. This is absolutely excellent news. And of course, this has got such huge implications for mass rollout for poorer countries, and indeed in some countries where people have to pay poor individuals. 66% again efficacy against any case of moderate to severe illness in a global large trial. But if you look at effectiveness against severe disease, you'll see it's 85% effective against severe disease. So all good news. Now, no specific data there on prevention of cross-infection. But if there's less people sick, less people have got the virus, it's logical that the data will come soon to show that this does reduce community transmission. I'm expecting that. And we have data from Pfizer and Oxford AstraZeneca that suggests that now very strongly indeed. No hospitalizations or deaths after 4 weeks. Now, we're going to be looking at this again from the Israeli data from Pfizer. But to have a large-scale trial as this has been and have no hospitalizations or deaths after 4 weeks is spectacularly good news. So in a sense, well, it's not in a sense, it actually does matter much less if the cases increase in the States now. It's still, we don't want it, but if it does, it matters much less because this is going to help to remove the link between cases and deaths. But we still have to do absolutely everything in the interim because we're not there yet. So all of these things and all the ventilation and everything that you need to, well, that we all know about now that we'll be doing for months, need to be carried on as if we have no vaccination programme for the time being. Although I think Dr. Fauci has been commenting on this, but I'm not going to quote him because I haven't got it at my fingertips. FDA, also Food and Drug Administration in the States, allowing undiluted frozen vials of Pfizer vaccine to be moved at freezer temperatures, not the minus 70 degrees centigrade as it was, for up to 2 weeks. So we looked at data about, it's probably about 10 days ago now. It's quite some time, probably about 10 days ago, from Pfizer that showed that the vaccine should be viable at these higher freezer temperatures, not the super low dry ice, the ice carbon dioxide kind of temperatures. So this now is FDA approved, and that is remarkably good news. That will tremendously help the logistical rollout. Canada has approved the Oxford AstraZeneca vaccine, absolutely brilliant, for 18s and older, 20 million doses with an advance purchase agreement. This is going to be a massive step forward for Canada. Don't know quite what the supplies are yet, but great to see that the Canadian authorities have approved it. In that respect, they're ahead of the FDA in the United States. But some people might say they've been a little bit slow. But glad they've got there eventually. Because this data has been available for so long now, really. I mean, if it had been any longer than this, it would have been really a cause for concern. So much data has been available for so long, and yet they've just approved it. As of the 26th, as of Friday the 26th, I think they approved it. South Korea, they started vaccinating on Friday. Again, South Korea, they were so much ahead of the curve with testing, for example, way back in February last year. Why has it taken them so long to get their act together on vaccination? I don't really know. It's taken quite a while. Now, a bit of news from the UK. Let's just have a look at this. Let's have a look at the. This is the COVID symptom tracker app that, of course, several million of us fill in on a daily basis. And here we see the people currently infected, the prevalence. The darker areas are the areas of higher prevalence. And you can zoom in on those and learn about your own area. The daily number of new symptomatic cases. This is fairly consistent with the data from the government at the moment. We'll look at that in a minute. So just under 10,000 symptomatic cases a day. Would expect the real number of cases to be slightly higher, of course, because of the asymptomatic cases. But again, the trends here are immensely gratifying. Now, it's still a lot. I mean, to have a prevalence of well over 150,000 in the country is still high, but the direction is really very good and very encouraging direction. But we need to keep this up. Remember, the lockdown easing doesn't start till March. When does it start? Was it the 9th of March from memory, when schools are open? Something like that. Anyway, let's look at the prevalence here. So going down quite nicely, going down steeply here. But we do see it's not going down as steeply. So cases are still declining, yes, but not declining as steeply as they were. So we need to really keep going with what we're doing. And I think we'll just take time to look at this graphic as well. Cases going up September, October, November, of course. Down a bit with the tiered system that we had. And then the new variant is just about to kick in, I'm afraid. And that is what the new variant does. That's why we're worried about the States. That's what the new variant does. And that's what lockdown does. And we are going to start seeing the effect of the vaccine as well. And if we look at the daily, let's just look at this daily summary screen. There's so many you can look at now. People tested positive, daily testing positive here, 8,523. Of course, that underestimates the total number because some people aren't picked up. So fairly accurate, consistent with the just under 10,000 we saw from the COVID symptom tracker app. Last 7 days down 16.8%. So that's quite a nice reduction. Deaths within 28 days of a positive diagnosis. These, of course, took longer because of the delay effect. But in the last 7 days, down 31%. And we are now, in this reduction in deaths, starting to see the effect of the vaccination, because we started vaccinating the most at-risk people and their lives are currently being saved. It's immensely gratifying to say that. These are lives being saved now by lockdown measures, yes, but now some of those lives, some of that 31% reduction, is as a result of the vaccination programme. Patients admitted to hospital going down, still quite a few patients in hospital. We're not saying the problem's over, there's still high pressures. And testing is pretty good in the UK at the moment. And again, local data if you want to click onto the site, and of course I always give you the link to look at. Now, we talked yesterday about the situation in France, where the president said he would now accept the Oxford AstraZeneca vaccine. So this is from Anthony, my correspondent in France, as regards to the Oxford AstraZeneca vaccine. And I'm just going to give you a bit of this letter because I think it's a fascinating perspective that he gives. Finally, following on from your comments about the EU powwow. You say powwow in the States. It means a bit of a punch-up, I think. So we did highlight this yesterday. The European Union had got together and they were wringing their hands and saying, where have we gone wrong? Because they have gone wrong. There's no question about that. However, France have finally agreed that there is potential evidence showing that it can be used for 65 to 74-year-old age groups. So the French are now agreeing that the Oxford AstraZeneca vaccine can be useful in older age groups. This goes on from the president saying it was quasi-ineffective, and the Germans also turning it down for the older age group. We critiqued those, and critique is the most polite way I can put it. We critiqued the French and the German decisions at the time on this channel. In fact, I think I came flat out and said they've got it wrong. Now they're now correcting that. Our impression was, without them ever admitting they have got it wrong, the Prime Minister passed on the Health Minister, who in turn passed on the French vaccines. It all seemed quite a bit of humble pie eating by the Prime Minister and Health Minister particularly. This is on French TV. When the vaccines started backpedaling on just about everything they had commented negatively about the AstraZeneca vaccine. Then mentioned that in a few days or weeks they will have analysed the data coming out of Scotland, which of course we showed that the Oxford AstraZeneca vaccine kept people out of hospital at a rate of 94%, which was better than the Pfizer vaccine, and that was in the older age group. That was in all age groups. And if it's passed by the French regulatory authorities, they will do a U-turn on the 65 to 74-year-old age group. But they're still not doing it yet. See, the Scottish data is there. It's unequivocal. Why are they still procrastinating? The faces of the Prime Minister and Health Minister when he is relaying this to the nation were a picture. Our opinion solely humble pie eating time. Current vaccine rollout still puts 65 to 74-year-old age group neither eligible for the Pfizer, which is for 75 plus, or priority groups. So 75 plus and the priority groups are getting the Pfizer in France. So people aged 65 to 74 aren't eligible for anything because they're not allowed the Oxford AstraZeneca vaccine below the age. They're not allowed the Oxford AstraZeneca vaccine if they're above the age of 65, and they're not allowed the Pfizer vaccine unless they're above the age of 74. So it's not funny. This is terrible. It's just so bizarre. That's why I'm sort of sniggering. So 65 to 74-year-old age group in France, as I understand it, and as Anthony writes here, they don't qualify for any vaccine at all. As the AstraZeneca vaccine is currently only available for under 50 to 64-year-old age groups. All we can hope for is one day soon EU and France get over Brexit and get on with the job in hand. Pretty obvious which is more important. We agree saving lives is always more important. And we did flag this up a good couple of weeks ago on this channel. Pity the French and the German authorities weren't watching. Now, the next thing I want to do, I want to look at this. Actually, I've gone on a bit longer than I meant to today. I want to look at this data from Israel. So because I've gone on a bit, I think I'll probably do this as a separate video. But basically, this is showing that the Pfizer vaccine is bringing out some really powerful, efficacious data from Israel. And this is based on a study of well over 1 million people. So real world data now coming out from Scotland, real world data coming out from Israel, real world data coming out hopefully within the next within the next days or week or two on the Oxford AstraZeneca vaccine in the UK. Of course, the Pfizer vaccine was rolled out first, so it's not surprising the data on that is coming through quicker. So I think I'll just do that as a separate video, actually. So we'll leave that one there for now. I'll do the other one. I'll do the other one straight away, so it should be up hopefully in an hour or two. But if you want to log back on for that, do so. It's well worth it, because basically this is confirming that the vaccine program is what the world is waiting for, and the real world data is confirming it in very nice ways. So back shortly with that, and thank you for watching this video.